Hello, everyone, and welcome back to RN Info, the place where you get clear, reliable information on health topics. Today, we're covering congestive heart failure, what it is, the symptoms, the types, and nursing management. To understand congestive heart failure, we have to start with the heart itself. What does the heart do? Simply put, it's the body's pump. Congestive heart failure means the heart is failing at that job. It can no longer pump blood effectively enough to meet the body's needs. Let's quickly review how the heart normally works. Blood returns from the body after cells have used up their oxygen and nutrients. It flows into the right atrium, then into the right ventricle, which pumps it to the lungs. In the lungs, gas exchange happens. The blood picks up fresh oxygen, then flows into the left atrium, into the left ventricle, and gets pumped back out to the rest of the body. Congestive heart failure simply means the heart can no longer carry out that process effectively. Now, let's talk about the types of heart failure. The heart has a left side and a right side, and either side can fail. Starting with the left side heart failure. This occurs when the left ventricle loses its ability to pump blood to the rest of the body, meaning cells and organs are not getting the oxygen and nutrients they need. Left-sided heart failure can further be divided into two types. First, systolic heart failure. This is when the left ventricle is too weak to pump blood effectively, resulting in reduced ejection fraction, meaning not enough blood is being pushed out to the body. Second, diastolic heart failure. This is when the left ventricle becomes too stiff to relax and fill properly with blood. Some common causes of heart failure include coronary artery disease, heart attack or myocardial infarction, uncontrolled hypertension, valvular disease, which prevents blood from flowing properly between heart chambers, and cardiomyopathy. Let's take hypertension as an example. When the left ventricle constantly has to pump against high pressure, it's like repeatedly overworking a muscle. Instead of staying flexible and efficient, the muscle gradually stiffens. The stiffer it gets, the less effectively it pumps, and over time, the pump begins to fail. Here's how the backup happens. Blood flows from the lungs into the left atrium and then into the left ventricle to be pumped out. If the left ventricle can't pump effectively, pressure builds up. Blood begins backing up into the left atrium and then into the lungs. That's where the symptoms of left sided heart failure come from, and they're primarily lung related. A helpful memory trick: left side and lungs both start with L. Symptoms of left sided heart failure include shortness of breath, even with mild to moderate activities. You may see a cough that starts dry, but gradually progresses to pink frothy sputum, a sign that fluid buildup in the lungs is significant. Patients may also develop orthopnea, which is the inability to breathe comfortably while laying flat, often requiring them to elevate their head to breathe more easily. On accostation, you will most likely hear crackles in the lungs. Now on to right-sided heart failure. This occurs when the right ventricle is too weak to pump blood to the lungs. As a result, blood backs up into the right atrium and then into the rest of the body. Remember, blood normally travels from the body, the arms, the legs, the abdomen, through the peripheral veins into the right atrium, then the right ventricle, and onto the lungs. When the right ventricle can't pump effectively, blood stays in the right ventricle and pressure builds, and it begins to back into the right atrium and out into the systemic circulation. That is why right-sided heart failure symptoms are mostly seen throughout the rest of the body. Another memory trick: right side, rest of body. But start with an R. Because fluid is being pushed back into the peripheral veins, it starts to leak out into the tissues. So the symptoms include ascites, which is fluid buildup in the abdominal cavity, edema in the lower legs, and weight gain from all that fluid accumulation. It is also worth noting that one of the most common causes of right-sided heart failure is actually left-sided heart failure. Now let's look at how we test for heart failure. We check BNP. This is a hormone the heart releases in response to pressure changes. When pressure builds up due to the heart's reduced ability to contract effectively, BNP levels rise. We also monitor kidney and liver function because reduced blood flow and venous congestion in these organs affect how they work. Electrolytes are important as well. Additionally, an echocardiogram helps us to evaluate heart function and measure ejection fraction, while an EKG shows us the heart's electrical activity. Now for nursing management. We want to closely monitor vital signs: blood pressure, oxygen saturation, and respiratory rate. Left-sided heart failure causes significant respiratory symptoms, so tracking breathing is critical. Blood pressure matters too, since hypertension can worsen heart failure. Medications such as ACE inhibitors and ARBs, which is angiotensin receptor blockers, are often used to manage blood pressure in these patients. Any significant changes should be reported immediately. We also monitor daily weights, so same time each day, same clothing, to detect fluid retention early. Lab work, including electrolytes, liver function, and kidney function, should be reviewed regularly to watch for medication side effects. Finally, patient education is essential. We need to make sure patients understand how to manage this condition at home and what warning signs to watch for, such as gaining 2 to 3 pounds in 2 days or 5 pounds in a week. To quickly recap, heart failure is when the heart can no longer pump enough oxygenated blood to meet the body's demands. Know the difference between the left-sided and right-sided symptoms and apply the assessments and interventions we covered. That's it for today's video. If you have any questions, drop them in the comments below. Thank you for watching, and I will see you in the next one.